Cotard's delusion, walking corpse syndrome. In 1880, French neurologist Jules Cotard encountered a patient unlike any other. A middle-aged woman, identified only as Mademoiselle X, claimed she had no brain, no nerves, no chest, and no stomach. She insisted she was merely a walking corpse, cursed to wander the earth despite being dead. She stopped eating, believing nourishment was pointless since her body no longer needed sustenance. Tragically, her delusion became a self-fulfilling prophecy. She starved to death. Cotard's delusion is a terrifying disorder where patients genuinely believe they are dead, decaying, or missing vital organs. Some even claim to smell their rotting flesh or feel insects crawling beneath their skin. In extreme cases, patients refuse medical care because they believe treatment is useless. After all, how can you save someone who's already dead? Capgras delusion. Imagine waking up one day and believing your spouse is no longer your spouse. They look the same, sound the same, but to you, they're an imposter. This is the grim reality of Capgras delusion. Named after French psychiatrist Joseph Capgras, this disorder convinces sufferers that their loved ones have been replaced by identical doppelgangers. One chilling case involved a man who refused to let his wife into their home for weeks, convinced she was a fraud attempting to steal his life. Capgras patients often experience extreme paranoia, sometimes leading to violent outcomes when they believe they are fighting imposters. Fregoli delusion. In 1927, Italian doctors reported the case of a young actress who believed she was being stalked by a man who repeatedly disguised himself as different people. This intense paranoia, known as Fregoli delusion, convinces sufferers that multiple people are actually the same individual in disguise, following them everywhere. Victims of this disorder often become consumed by fear, convinced they're being manipulated, hunted, or controlled, turning everyday life into a nightmarish game of hide-and-seek. Ekbom syndrome, delusional parasitosis. One of the most distressing conditions imaginable, Ekbom syndrome causes people to believe they are infested with insects or parasites beneath their skin. The sensation is so vivid that sufferers often scratch themselves raw or even use razors to cut out the perceived invaders. One infamous case involved a woman who brought a jar of evidence to her doctor, filled with skin flakes, hair, and lint, convinced they were insect eggs. The tragic reality? The only thing growing was her paranoia. Fatal Familial Insomnia. Fatal Familial Insomnia is as terrifying as it sounds, a rare genetic disorder that locks its victims in an endless state of wakefulness. Symptoms begin with mild insomnia but quickly spiral into total sleep deprivation, causing hallucinations, confusion, and eventually organ failure. One documented case involved an Italian man whose sleeplessness worsened till he was trapped in a constant waking nightmare. Despite medical intervention, he died just months later. There's no known cure, only an inevitable descent into madness and death. Alien hand syndrome. In 1908, a German doctor first reported a case of a woman whose hands seemed to rebel against her. While she calmly tried to fold laundry, her rogue hand would violently throw garments across the room. Alien hand syndrome occurs when the brain loses control over one hand, making it act as if possessed. Some sufferers describe their hand attempting to choke them in their sleep or striking their loved ones with no warning. The horror of feeling your own body betray you is enough to push many patients into total isolation. Diogenes syndrome. Named after the Greek philosopher Diogenes, known for rejecting social norms, this disorder drives sufferers into extreme hoarding, self-neglect, and social withdrawal. Victims often live in unspeakable filth, their homes cluttered with mountains of garbage, rotting food, and sometimes even dead animals. One heartbreaking case involved an elderly woman found buried under a decade's worth of newspapers in her apartment, long after she had passed away. Tragically, Diogenes syndrome often goes unnoticed until it's too late. Jerusalem syndrome. Each year in Jerusalem, dozens of tourists experience a bizarre psychological break. They suddenly believe they are prophets or messianic figures. They may dress in white robes, stand on street corners declaring divine messages, or attempt to enter holy sites claiming they are chosen. The phenomenon is so common that Jerusalem hospitals have specialized units just for these cases. Often triggered by intense religious devotion, the syndrome typically resolves after a few days, but in rare cases, it escalates into permanent psychosis. Stendhal syndrome. In 1817, French writer Stendhal described feeling dizzy and faint after seeing the breathtaking art of Florence, Italy. Centuries later, psychologists identified this as Stendhal syndrome, an overwhelming reaction to beauty that can cause fainting, hallucinations, and even panic attacks. Victims describe feeling their heart race uncontrollably or falling into trances after viewing certain paintings or sculptures. Florence hospitals still report cases to this day, especially near the famous Uffizi Gallery. Boanthropy. Perhaps the most bizarre of all, boanthropy is a rare delusion where sufferers believe they are cattle. Victims have been found grazing on grass, walking on all fours, and mooing like cows. Historical records suggest that Nebuchadnezzar II, the mighty Babylonian king, may have suffered from boanthropy, spending years wandering the wilderness in an animal-like state. While modern cases are rare, they remain one of the most unsettling examples of how the mind can shatter reality. Alice in Wonderland syndrome. In 1955, British psychiatrist John Todd identified a disorder where patients experience dramatic distortions in size, time, and perception, as if they'd stepped into Lewis Carroll's famous story. Victims may believe their body parts are rapidly shrinking or growing, or that objects around them are distorted in surreal ways.